Hello, everybody. Welcome back to the Beat Podcast, recorded here at Health in Las Vegas 2025. I have the privilege of hosting Seth Cohen today. He is the president at Cedar and also a member of its board of directors. Previously, Seth was CEO and co-founder of the OODA Health, a healthcare technology company that was acquired by Cedar in 2021. I am so excited to be with you here, Seth. Thanks for joining.
Yeah, excited as well.
So look, I'm very familiar with your company. You know, just at HFMA a few months ago, had a good chat with Dugan from your team. So I'm excited to continue the conversation with you guys. So first of all, before we get into the questions, I'd love to just better understand Cedar, help our listeners understand what you guys do.
Yeah, so the elevator pitch is that Cedar's focused on the patient financial experience. So if you think about revenue cycle overall as a category, most of the time, the focus on revenue cycle is payer reimbursement, right? Because the payers are driving the majority of the reimbursement. We are uniquely focused on the patient financial experience. And we'd argue that's a really important place to spend time on because patients are the fastest growing payer. They have the worst outcomes in terms of write-offs, and they're the most expensive to collect from on a per dollar basis. So that's our focus. So we manage that experience on behalf of large hospitals and health systems and physician groups. And our value prop is we drive higher collections while creating a better experience for patients.
Well, that's a fantastic focus.
Thank you.
I mean, all those stats are troubling,
Right,
in a big way.
Right.
And if you take a look at this very critically, there's a huge opportunity here. Lots of value to be derived. So Seth, health is all about the big forces reshaping healthcare. From your perspective, how is the affordability crisis actually playing out at the front lines for both patients struggling to pay and providers struggling to keep the lights on?
Yeah. So let's just level set. You mentioned that we talked some stats earlier. Let me level set here, right? So we all know healthcare trend has been on an unsustainable pace, right? It's growing way faster than inflation every year. It's a problem, right? Your audience probably doesn't need that education. What sometimes is less clear is that every single year for the last 20 years, patient out-of-pocket expense has grown faster than overall medical trend. So think about that. So what that means is that patients are bearing disproportionately the incremental expense in our healthcare system year after year after year. To the point now where in 2023, the majority of Americans now have a high deductible plan. So the majority of Americans are now paying $3,000, $6,000, $10,000 out of pocket. And most of them do not have the capacity to pay it. So that's sort of setting the stage. At the same time, we're seeing an enormous growth in the percent of patients who have no insurance coverage showing up at providers. In fact, now we have data now across 55 clients, 30 million patients. Our data shows that about 35% of all dollars owed to a provider from patients, about a third, are owed by patients with no insurance coverage. Okay, so what does this all mean? So we have enormous increases in out-of-pocket expense. We have patients who have no insurance coverage whatsoever, now comprising a third of what's owed to these providers. That's really bad for providers because if someone has a $5,000 deductible and they have no capacity to pay it, it doesn't matter how kind you are or how great the billing functionality is in your Epic MyChart, they cannot pay.
Right.
So you're going to write that off as a provider. And for the patient, it's an enormously stressful experience. And something that we talk about to our provider community is we sort of challenge them a little bit and say, look, we get it. You didn't cause this problem, but here we are. And so if you're committed to a mission of healing your patients, how do you define healing in this context? Can you repair someone's heart and ruin their credit and declare you've healed that patient? We're putting patients through enormously stressful experiences that don't fit the rubric of a few years ago.
Yeah, I mean, such great points there. And you put it so well, like, can you repair their heart but mess their credit up? And you're still messing them up in a way, right?
Yeah, the patient relationship is far more financial than it's ever been, right? Once upon a time, we'd show up, we'd pay a copay, it's sort of like the dentist, and that was it. It was a footnote to the experience. But now, the last part of someone's care delivery is managing a really stressful bill that they don't have capacity to pay. And whether we like it or not, that is part of the care experience.
Yeah, and I can't believe it's 35%. That's such a big number. It's
huge.
Surprising.
And
how big
growing.
It is. And
right?
growing.
We haven't talked about the big, beautiful bill yet. I don't know if you want to go there, but that is the one sure thing we know about this bill is that it's going to increase that number further because 1 out of 10 patients who are on Medicaid today will lose coverage.
Yeah. So you at Cedar are unveiling Cedar Cover here at Health. Can you break down what it is, and why you describe it as the first proactive digital coverage safety net, something that goes beyond the traditional billing or enrollment tools that providers have relied on.
And I get that was a mouthful. So let me try to break it down. So we have some context here that we now understand, right? Is that the patient out-of-pocket's been growing so fast, you now have 35% of dollars owed from patients who really have no capacity to pay. And what that meant for us, what we were struck by is, well, wait a second, Cedar was started about 9 years ago, really focused on improving the billing experience. Like, how do we create consumer-grade, modern bill pay functionality so that it feels as easy as other consumer purchases? That's how we started. But when we have trends like this, if I'm a patient with no insurance and I have a $12,000 bill that I'm getting from a provider, do I care if they accept Apple Pay? Does it, I mean, you're laughing, right? So does it matter if they text me my paper statement instead of send it in the mail? None of that matters. And so it was a bit of a wake-up call for us in the spirit of kind of where's the puck going, of saying, oh my gosh, like this is no longer just about billing. We have to help these people get connected to resources to get them to coverage. That is Cedar Cover. It's figuring out, okay, identifying who are the patients who need help navigating the resources and how do we make it as seamless as possible, whether it's insurance enrollment, getting them into Medicaid, getting them to ACA, getting them into pharmacy copay assistance programs, getting them to financial assistance, right? There are resources out there for patients. We just don't get them today because they don't know to even look for them.
And you may not know the answer to this, but I'm just curious now that we're talking the numbers, is like, so out of the 35%, like how many of those are insured and how many of those are on government programs versus not insured?
Oh, the 35%, those are all patients with no insurance coverage today.
Okay.
Many of whom are eligible.
Got it.
Yeah.
Got it. So those are all uninsured.
Those are all uninsured.
Okay.
So, and just to be clear, it's not 35% of patients. The number is lower than that. It's 35% of dollars owed. So what we're seeing today, it kind of varies, somewhere between 5 to 12% of patients are showing up with no coverage, but they're generating disproportionate dollars owed because they have such big balances.
Okay. So you said 5 to what percent?
I mean, I'm
Ish.
5 to 12-ish, yeah,
Right,
depending
5 to 12,
on the
5 to
state,
12. Yeah, there's a lot of variation,
Right.
but you're a numbers guy, right? And so I'm getting into the numbers with you.
Yeah, sure, let's go there. Nerd out with me.
Yeah, and so, wow. Okay, so you've got this, let's just call it mid to high single, low double-digit percentages of patients that are showing up without insurance, but yet they're creating 35% of non-paid bills.
That's right, you got it.
That's massive. Okay, thanks for clarifying.
And we're talking numbers, and I love the numbers, but what I often am reminded of is that every one of those dollars, I mean, there's a patient behind it, like someone who's super stressed out about this, trying to navigate in a moment when they should really be healing from whatever they went through.
Yeah. It's a big issue. When you talk about affordability, healthcare is definitely one of those things that is definitely challenging. We could get started on education, but that's a different thing.
Yeah. We're going to solve healthcare first, and then we'll go to education.
And then we'll work on
next
that.
podcast.
Sounds great. Sounds great. For now, ship your kids to Europe for school.
Right.
That's a near-term solution. So Cedar Cover, let's learn a little bit more about that. It's already live with providers.
Yes.
What results are you seeing so far, both in terms of patient experience and also provider financial outcomes?
Yeah, thank you for pointing that out. No slideware here. This is not just like we launched a PowerPoint, we launched an idea, and come back next year. We are live. And we're very proud of that, right? Because we know there's so many announcements at health. There's so many things to try to keep track of.
A lot of noise.
Real results. And so a couple things I'm particularly proud of. One is we have a 97% Medicaid application success rate. So what does that mean? We are identifying patients who are in need of insurance, and we are hand-holding them through the application process and getting those applications submitted with a 97% success rate. Healthcare so often is a zero sum, right? It's payer versus provider, and it's coming out of one pocket and into the other. This is a situation where you as a patient really want that coverage because it's no cost to be in Medicaid. And now that really scary bill is zero for you because there's no out-of-pocket in Medicaid. And it's really great for the provider because it's third-party reimbursement they wouldn't have got. So it's just such a wonderful, small example of a win-win. Another one we're really proud of is $12,000 in medication assistance is the average subsidy that we're able to get for folks who need pharmacy copay assistance. So on this one, right, like just like on the medical side, drugs are really expensive. There's infusions and specialty pharmacy, and manufacturers make available patient assistance programs to help ensure adherence to drugs and is sort of a benefit to the community. Patients don't know about these things. The front office and providers don't know about these things. And so we're able to help connect people, remind them, and we're getting $12,000 of benefit per patient. And then another one that I'm proud of is 30% increases in insurance reimbursement for folks who have been denied in their claims. This is something we call coordination of benefits. It's a really wonky corner of healthcare. Basically, what it means is you show up and you presented your insurance, but it turns out you have supplementary insurance. You might have a workers' comp benefit. You might have a supplemental payer program, and you just forgot, and you didn't know to tell the provider. Well, that gets denied because the payer says, oh, no. So you got other coverage. You got to go tell us what that is. And then the patient just gets stuck in some sort of denial loop. We're identifying those patients, helping them connect to their supplemental coverage, and getting 30% increases in reimbursement as a result.
Cedar cover.
Cedar cover.
I love it. I love it. Wow. Yeah. It's just perplexing to me how these gaps exist and how we don't know these programs are there. And if you do, then how difficult they are to get going. Like it's a challenge.
It feels overwhelming today as we're sitting here as two healthy people talking at a conference. Imagine how much worse it is if you're recovering from a cancer treatment or you're getting chemotherapy. I mean, we put the burden on people in their least capable moment too.
That's for sure. So where do you see this going 3 to 5 years from now?
Well, I see the problem only getting worse, sadly. And one thing I joke about is, not that it's a funny topic, but joke is how certain we all are that this isn't going to just go away on its own, right? I sort of jokingly point out, ask people, anyone think that patient cost share is going to go down? Are patients going to pay less for healthcare over time? I have yet to meet anyone who can claim with any conviction that that's the case. We all know what direction it's heading. And so with that in mind, we know that this is a place that needs attention, that needs investment. And I think where we want to go is continue to expand the umbrella of what we can connect people to, right? So we talked about a few examples today: insurance reimbursement, pharmacy copay assistance. Well, there's workers' comp benefits. A lot of times patients show up and they don't know they're eligible for workers' comp. Maybe we can help them with that. Social security benefits. I actually had a provider talk to me about food SNAP programs. And I was thinking, why would we get in the business of connecting people to SNAP benefits? And then we realized, talking to them, I was like, no, these are patients who are choosing either to get their groceries or to pay their medical bills. And so again, back to how do we want to define healing and the journey of healing? I think it's relevant. Whether we like it or not, this is all part of that patient experience. So I see next 3 to 5 years, number one, the problem getting worse, the problem getting more urgent to solve. And number two, expanding our umbrella of resources so we can connect patients to more and more solutions that are out there.
Well, I'm glad you guys are doing this, Seth. It's making a big difference for the provider organizations, large health systems that want to learn more. Where can they reach out?
They can reach out. They can come to our website, cedar.com. It's a delightfully easy domain name. You can also reach out to me directly. I'm Seth at cedar.com. It's pretty straightforward, but we'd love to talk to folks.
Brilliant. There you go, folks. A great way to get in touch with Seth Cohen, president of Cedar. And why not? If you've got 35% of your receivables sitting there that are attributed to patient pay, find a way to do it. And you don't have to do it on your own. Now's the time to check out Seth and his team to help with that.
Thank you.
Seth, thanks for being with us. This has been an incredible pleasure.
It's a pleasure. Thank you so much.